So let's talk something about the mitral stenosis. So in this graphical presentation, which is the 2D echocardiography image, where you can see that there is a mitral stenosis. So whenever there will be mitral stenosis, the valve surface area become reduced, and because of that, a pressure gradient is generated between the two chambers, the left atrium and the left ventricle. So if you look the 2D echocardiography image showing here, you can see that this is a little bit dilated left atrium. Then the mitral valve, which is not opening properly because of the stenosis. Then you can see the left ventricle. So there is a pressure gradient between the left atrium and the left ventricle, and the narrowing of the mitral valve can cause dilatation of the left atrium that can lead to a fib. So whenever the surface area of the mitral valve reduces, we can say that this is we can say that this is the mitral stenosis. So the normal size of the mitral wall is approximately 4 to 6 centimeters square. If the size of the mitral wall reduces, then we can say that this is the stenosis. But there are certain parameters, there are certain values that divides the severity into different gradings. There is mild mitral stenosis, moderate mitral stenosis, severe mitral stenosis, and critical mitral stenosis. So, if you talk about the first one, that is the mild mitral stenosis, then you can find the surface area of the mitral valve is approximately 1.5 to 2 centimeters squares. The second one is the moderate mitral stenosis, where you can find the surface area between 1 to 1.5 centimeters square. In case of severe mitral stenosis, the size become less than 1 point or less than 1 centimeter square, and in case of the critical mitral stenosis, the size or the surface area of the mitral valve become less or equal to zero point 0.5 centimeters square. So if you talk about the causes of the mitral stenosis, then there are a lot of causes. Some of them are if there is bacterial endocarditis that can lead to calcification in chronic stages, and that can cause mitral stenosis. In age-related conditions, that can also lead to dystrophic calcification of the mitral valve that can also cause mitral stenosis. Some congenital conditions where you can find bicuspid valve that can also lead to calcification and damaging of the valve that can lead to mitral stenosis. So a patient with mitral stenosis has high chance of having atrial fibrillation because of the pressure gradient that can cause dilatation of the left atrium, and the left atrial dilatation can cause the generation of ectopic foci that can leads to atrial fibrillation. So the treatment is depends upon the severity of the mitral stenosis, but in general the patient must treat it depending upon the condition, depending upon the sign and symptoms. The patient should give some anticoagulation, The patient must have beta blockers in order to inhibit the atrial fibrillation. The patient